yet. Okay, so now going back to schizophrenia, and now I would like to talk a little bit about sex differences in schizophrenia overall, in the epidemiology, symptomatology. So when I talked about the early age of onset, it's actually earlier in men, on average about 3 years. And because the peak is earlier in men, so it's in late teens, early 20s, and for women it's a little later. And there's been for years this controversy: do more men have schizophrenia, or not? And people still discuss it. But one thing that there is kind of consensus on, that before the age of 40, there's more men with schizophrenia, and there after the age of 40, again, when we see these hormonal changes, there is a second peak for women, whereas for men it's a very low incidence. So there's something, there's this second peak. There's something going on, again, related to the hormonal changes probably. Other differences: overall men show poorer premorbid function, more cognitive symptoms. They respond less well to treatment. They have more brain abnormalities. They show, and not all the studies show that, but there are some studies that show that men exhibit more negative symptoms, such as social withdrawal, poverty of speech, lack of motivation, and women show more affective and more positive symptoms, more hallucinations, delusions, dysphoria, impulsivity, more aggressiveness even. We know they are we knew this. We actually know for, since the establishment of schizophrenia as a diagnostic entity. But there wasn't much investigation into what could be the underlying mechanisms of it. At some point when we had available technology, people started looking at, are there any differences in brain structure, maybe brain function? So there have been a few studies, and some of them show the sexual dimorphism in the same direction as we see in the normal population. So for example, men with schizophrenia have larger ventricles than women with schizophrenia. And overall, in the general population, men have larger ventricles than women. So it's the same direction. What's interesting about this finding is that the studies, they've been, like I said, over 100 of studies that showed enlarged ventricles in schizophrenia, and there have been some theories created around it. But most of these studies used primarily men. Now, when we look at women, they actually don't show much enlargement of ventricles. So it's mostly men. So we see this difference. We see smaller overall frontal and temporal lobe volumes. Again, that's true for the general population. So it's the same. It's in the same direction. Again, not all the studies found this, but there were a couple of interesting studies that appeared a few years ago and got me going and got me interested. And one was again by Goldstein, who is an expert on all these sex differences in the brain, in the general population and in schizophrenia. And again, this is just so you appreciate what she does. There is the segmentation into these different regions. And so she looked at all these different regions and found something very striking at the level of anterior cingulate, which is implicated in the processing of emotion, and it's kind of an intermediate between cognition and emotions. And normally it is larger in women than in men, but in schizophrenia, it was the other way around. So it was larger in men than in women. A different study, a couple of years later, another prominent researcher in schizophrenia, Gur, she looked at now just two regions, orbitofrontal cortex and amygdala. And here this is from her paper. And again, in the general population, we find that this is larger in females, whereas amygdala is larger in males. But the opposite was true for schizophrenia patients. And she was actually the first that suggested and put it in this paper that we might have here masculinization of females with schizophrenia and feminization of males with schizophrenia. at least at brain structure. And maybe it is related to symptoms, maybe it is related to something else, maybe to hormones. So I thought, okay, so we have these anomalies, this reversal of sexual dimorphism in anterior cingulate, orbitofrontal cortex, amygdala, the three major players in emotion processing. So I thought, well, let's check out the studies of emotion processing. I haven't really seen anything on sex differences, but I just wanted to look at the studies who investigated emotional processing. And I found there were no reports of sex differences. And when I started looking at the patients, it was because most studies were done primarily on males. And even if there were mixed samples, the numbers would be too small to compare. If you have 12 subjects and 3 are women, you cannot do any sex differences. So we had some data available in the lab, and it was during performance of 2 emotional tasks, and we thought it was only in patients, but we thought, let's try it, let's see what happens. So this was from 10 women and 15 men with schizophrenia, and they performed 2 different tasks, emotional. One was a passive viewing of a sad film relative to the neutral film on gardening or plumbing, and the sad film was an excerpt from the film that The Champ. I don't know if any of you saw it. But there is a very sad scene of a father dying in front of his son, and then the other task was pictures, static pictures that were aversive, and we compared this with neutral pictures such as umbrella. So just briefly, because these were preliminary findings only in patients, we did find differences. We found that men showed more activation during exposure to the sad film in cingulate gyrus, in kind of parietal region, prefrontal region, and SMA. In cingulate I mentioned. And then we looked at the pictures, and the same thing, much more extensive activations. So we did have sex differences, except that we couldn't say, is it normal? Is it in the right direction? Is it in the wrong direction? Is it masculinization, or is it just a regular thing? So this served as a preliminary data to design a good study where we thought now not only we're going to look at the functional, because these were all functional MRI data, but we'll use also event-related potential. I decided to include, in addition to emotional processing task, other tasks that have been shown differences between men and women in the general population. Visual spatial abilities task, specifically mental rotation, because that's where we see the most robust findings, and episodic memory. And we started measuring hormones, and we started measuring gender role and identity. Unfortunately, and we had the introduction, the only thing available to us was BEM sex role inventory. So we are in the process of trying to incorporate other scales looking at this. We look also at sexual preference and other things to just have a little more data in gender. Okay, so usually, so far, and we are almost at the end of the first phase of the study, and we're hoping to continue with the second phase. We have tested 35 schizophrenia patients, 18 men and 17 women, and the same number of control subjects. And we have obtained very interesting, I think, results. So this is, first of all, during exposure to negatively valenced pictures, so negative emotions. So healthy men, healthy women, schizophrenia men, schizophrenia women. And even without, I think, naming all the brain structures, these are renderings on the 3-dimensional brains, I think you can appreciate how this group is similar to this group and how these group look alike. So basically, there is, it seems like almost a reversal of sexual dimorphism in the brain function during exposure to these negative stimuli. But during this task, we also included positive emotion. Is the same thing happening here? We know that in the studies of general population, often the sex differences are less frequently reported. So we didn't find the same thing. So it's less clear-cut. We don't find sex differences in the general population, but we do find sex difference in schizophrenia patients. So we cannot say that here it's a reversal, but there is some disturbance again of the normal sexual dimorphism. Now, these findings were also supported by EEG. And again, I'm not going to go into specific details, just want to show you that now we find it with different modalities, and you will see with different tasks. So especially at the negative emotional level, you see here controls, more activation in men than in women. That's what we saw with fMRI, and inverse situation in patients. So we included in our battery mental rotation task. And like I told you, we did it because we knew that there is a robust sex difference in a general population. And we knew there is a robust difference in functional MRI studies. Basically, the version that we use, it's the most popular and produces the most significant differences. People are presented with the pairs of three-dimensional shapes. And they are either identically positioned or they're mirror images. I don't have the mirror images. And this is a control stimulus. And in the experimental condition, the two are rotated. And now the task of the participant is to determine, are these mirror images or are they identical? And I don't know, you can do it for yourself, as fast if one is mirror images, one is identical. And so here's what we found.